Assalamu alaikum dear students. Today we will discuss anatomy most important MCQs part 1b. There are dash pairs of thoracic nerves. Option A 5, option B 7, option C 8 and option D 12. So the correct option is D 12 pairs. Explanation is there are 12 thoracic spinal nerves T1 to T12 corresponding to the 12 thoracic vertebrae. At what level does the mbbs lie? Option A just below the sternal notch. Option B at the level of T3 T4 vertebra. Option C at the level of T4 T5 vertebra. And option D at the level of T3 T5 vertebrae. So the correct option is B at the level of T3 T4 vertebrae. Explanation is the mbbs upper part of the sternum lies opposite to the T3 and T4 vertebrae. The sternal angle where the mbbs meet the body of the sternum is at T4 T5. Subscribe now and press the bell icon. Never miss an update from early technologist. What lies at the medial surface of the lungs and is the place where pulmonary vessels, bronchial vessels, lymphatic vessels and nerves enter and leave the lungs? Option A the ileum, B the duodenum, C the jejunum and option D the ileum. So the correct option is A the ileum. The ileum is the lung's root where pulmonary vessel, bronchi, nerves and lymphatics enters or exit. So this is very important MCQs. The dash is a mobile single bone found in the midline of the neck below the mandible and the larynx. Option A cervical vertebra, B clavicle, C hyoid and option D mandible. So the correct option is C hyoid. Explanation is the hyoid bone is U-shaped, floats in the knee and supports tongue, oblique, larynx muscles. It's the only bone not articulating with another. The incomplete fusion of two medial nasal swelling results in the production of option A lateral cleft of the upper lip, B medial cleft of the upper lip, C macrostomia and option D microstomia. So the correct option is B medial cleft of the upper lip. Explanation is a median cleft lip rear occurs when medial nasal processes fail to fuse. Lateral cleft more common involve maxillary process. So this is very important MCQs. Acromial fiber of the deltoid are examples of option A bipinnate, B multipinnate and option C tripinnate and option D unipinnate. So the correct option is B multipinnate. So the deltoid acromial fibers are multipinnate feather-like arrangement, maximizing force production. for shoulder abduction. So this is very important MCQs. The nasal cavity is divided into two by the bony nasal septum, which is laryngeal, formed by option A, inferior conchi, option B, lacrimal, option C, maxilla, and option D, vomer. So the correct option is D, vomer. The vomer forms the posterior inferior part of the nasal septum, while the perpendicular plate of the ethmoid form the superior part. Symphysis pubis is an example of option A, diarthrosis, B, fibrous joints, C, primary cartilaginous joints, and option D, secondary cartilaginous joint. So the correct option is D, secondary cartilaginous joint. Explanation is a secondary cartilaginous joint has fibrocartilage and limited movement. So this is very important MCQs. The angle decrease between the two anterior surfaces is option A, abduction, B, adduction, C, extension, and option D, flexion. So the correct option is D, flexion. Flexion reduces the joint angle, for example, bending the elbow, and the extension increases it. The location of the spleen in the abdomen is option A, epigastrium, B, left hypochondria, C, left iliac fossa, and option D, right hypochondria. So the correct option is B, left hypochondria. So the spleen resides in the left hypochondrium, protected by ribs 9 to 11. It's part of the lymphatic system. The basic cells of cartilage are option A, chondrocytes, B, osteocytes, C, osteoclast, and option D, mast cells. So the correct option is A, chondrocytes. The chondrocytes maintain cartilage matrix. Osteocytes are bone cells, osteoclasts resorb bone. So this is very important MCQs. True ribs directly attach via cost chondral to the option A, menobrium, B, sternum, C, vertebrae, and option D, xiphoid process. So the correct option is B, sternum. So explanation is ribs 1 to 7 true ribs connect directly to the sternum via costal cartilage. Ribs 8 to 10 are false ribs. The lower jaw bone is known as option A, ethmoid, option B, maxilla, option C, mandible, and option D, sphenoid. So the correct option is C, mandible. The mandible is the movable jawbone, and maxilla is the upper jaw. Mediastinum, which lies between the pericardium and the vertebral column, is option A, anterior mediastinum, B, inferior mediastinum, C, middle mediastinum, and option D, posterior mediastinum. So the correct option is D, posterior mediastinum. The posterior mediastinum contains the esophagus, descending aorta, and azygous vein. The heart is innervated by sympathetic and parasympathetic fibers of the autonomic nervous system via the option A brachial plexus, option B cardiac plexus, option C femoral plexus, and option D lumbar plexus. So the correct option is B cardiac plexus. So the cardiac plexus deliver autonomic sympathetic and parasympathetic fibers to regulate heart rate. If you like this video, please subscribe my YouTube channel. अगर आपको ये वीडियो पसंद है, बराए मेहरबानी मेरे YouTube चैनल को सब्सक्राइब ज़रूर करें. The inferior thyroid arteries supply the upper two-thirds of the trachea and the lower third is supplied by the option A axillary arteries, B alveolar arteries, option C bronchial arteries, and option D carotid arteries. So the correct, and option D subclavian artery. So the correct option is C bronchial arteries. The bronchial arteries from the aorta supply to the lower trachea, while inferior thyroid arteries feed the upper trachea. The umbilicus is a scar representing the site of attachment of the umbilical cord in the fetus. It is situated in the option A linea talus, B labia majora, option C linea alba, and option D labia minora. So the correct option is C linea alba. The linea alba is the midline fibrous band where the umbilicus belly button form. Thank you for watching my videos.